Okay, welcome everybody. This is a totally free and open class on Pañchakarma, and I would love to answer any of your questions. Hi, Karthikeya, nice to see you here too. It's really wonderful to see so many people from all around the world joining, so thank you all again for making the time and being here with us today. I think folks are probably a little curious about what Pañchakarma is, and we can start at that level if that's what is going to be helpful for people. I can talk a little bit about what it is, kind of how it sits in Ayurveda, what is its context and that kind of thing. I'd also love to hear if you guys have any specific questions, and I can start sort of organizing those in my mind and trying to answer those as I go through. Does anybody have any particular questions that they would like to ask? Any and all questions are welcome.
Is India really the best place to have this this treatment, or are there very good places in Germany, U.S., England?
Very good question. Yeah, so this is one of the first and most important questions. Is India really the best place to go? And it's a little bit more of a complicated answer. And so, Carl, let me take a little time to couch that in the context of what the whole thing is. But that's a great question. Thank you. Other questions? Who has any other questions? I know there's probably some hiding out there. Anybody?
I'm so new to this, I don't know what to ask. So you have a blank slate for as far as I'm concerned to go forward.
Perfect. Thank you, Anne. That's wonderful. Yeah, so guys, why don't I get started just by giving a little context of what Pañchakarma is. And where did it come from? Why is it here? What are we trying to achieve with this? Well, this is a bigger part of Ayurveda. And if you're here, you probably know about Ayurveda at least a little bit. You've probably at least heard the name. And you may have tried it, but you may not have tried it. And that's great. I love being able to introduce people to Ayurveda because the way that I do it is a little bit different from the way that most people do it, kind of in the popular space. And what I like to refer to as commercial Ayurveda. What you see out there today from most people looks like something that's a very deep set spiritual practice. It looks like maybe, I don't know, do I need to start wearing Indian clothes? Do I need to start eating Indian food? Do I need to start, changing kind of like my whole cultural leaning towards something else to be able to do Ayurveda? And that's a pretty common question that may not even come up consciously for a lot of people, but because of what we see out there so frequently, that it certainly becomes an issue that needs to be addressed. And so I'd like to start right off by saying that Ayurveda is a well-developed scientific, systematic medical system. It's a healthcare system that has been used for thousands of years, and it has two main goals. One is to maintain the health of the healthy person, and the other is to alleviate and eradicate diseases of sick people. So yes, Ayurveda is meant to cure disease. And this is something that a lot of people may not be able to convey as clearly if they haven't had experience in Ayurvedic hospitals in India, where we see this happening on a daily basis. So Ayurveda is a very powerful system of medicine that gives us the ability to maintain health in all forms of prevention and address specific clear-cut pathology with very specific lines of management. And that's a whole topic of conversation that I'm not going to go into today, but we're going to look at sort of the prevention and the curative aspects of this as the goals, and then bring Pañchakarma into the equation. For those of you who have tried Ayurveda, right, you might have gone to somebody and they said, oh, drink some golden milk, or, you know, eat some turmeric, or have certain spices in your food, or drink hot water, or drink CCFT, right? Cumin, coriander, and fennel. That's a really common one in the commercial Ayurveda space. So there's all these sorts of little ideas that are out there, and the question naturally arises, do they work? Who should use them? Why, right? So Ayurveda starts out at the simplest level of itty-bitty things that you can do on a day-to-day basis, like simply drinking freshly boiled hot water. And then it goes all the way almost to the other end of the world, let's say, or the other end of the universe would be a better example, with Pañchakarma, whereby we are changing the underlying physiology and the mechanics of the human body while the person is still alive. Pañchakarma is that powerful that it's like taking a car's engine apart while the car is running and putting it back together while the car is still running. And obviously we know we can't do that with a car that's running, or that would be incredibly, ridiculously difficult, pretty much impossible. Right, so how is it that we're able to do this with a human body? How can we break it down so well and then put it back together? Well, that's how complex Pañchakarma is. It's able to go in with surgical precision and identify where pathology is brewing. And then it's able to target that, slice that pathology off. Again, with surgical precision, it's like it cuts the waste products out of the body, and it scoops them up, and it safely brings them into the gastrointestinal tract and ejects them. This almost sounds a little too good to be true. Like, how could that even be possible? And if it were possible, what wouldn't Western medicine already have been doing this, or some kind of idea like that? But this is actually a practice that has been part of Ayurveda for thousands of years, since the very beginning. It is really one of the 8 core branches of Ayurveda. And it's there to help regenerate, rejuvenate, and prime the body for healthy reproduction. And so these people who designed this whole Ayurvedic system, they were so smart, they were so good, that they had everything planned for. They had it all thought out. And so it wasn't just this haphazard kind of thing like, oh, somebody goes out and whoop, somebody got pregnant and here comes the next generation. But it was very carefully designed that the next generation would be as healthy as possible. Why? Because prior to conception, the parents would undergo this extensive cleansing, deep cleansing process, so that their reproductive systems were as capable as possible prior to that conception. So this is just a little example of how Pañchakarma could be used in classical perspective, like why was it there? What did people want to do with it? And now fast forward to today, this still is practiced every day in Ayurvedic hospitals in India, some more so than others, of course. It is considered to be a very expert level practice. And students who graduate from the 5.5-year Ayurvedic medical program can go on for further super specialization in Pañchakarma. They can do an additional 3 years in a master's degree or a postgraduate degree in Pañchakarma. They can do an additional 3 years beyond that in a PhD in Pañchakarma. Now imagine that somebody's got 6 years of full-time foundation Ayurvedic medical education, topped off with 6 more years of super specialization in this particular branch. And so, Carl, to start to answer your question about is India really the best place to do this? I think that would be a big plus in their bucket for having experts who have that level of knowledge, experience, practice, skill, and of course all the facilities and the medicines to be able to do all of these things. We don't find anything comparable to this outside of India today. Right? So all this stuff exists in India, but nobody really knows about it because it's not like it's on the main track for, tourism. It's not like there's a huge line of people waiting to go to Ayurvedic hospitals in India to do Pañchakarma. Or if there are, again, they're associated more with this sort of commercial Ayurveda, New Age Ayurveda, spiritually focused Ayurveda. And they really have done a great job at missing the medical point of Ayurvedic medical practice. So just be aware of that and know that there's a lot more going on than maybe what you can find easily and readily if you're going to search around for it. So in terms of who is eligible for doing this, it's pretty clear in classical literature, and it says that every person between the ages of 30 to 70, so basically in middle age, is recommended to do some form of Pañchakarma every year during that 30 to 70 range in order to keep the body in its cleanest state, maintaining homeostasis as well as possible, and to avoid chronic disease in old age, which goes from about 70 years up to 100 or whenever the person passes. So Pañchakarma is like this annual cleansing process that allows the body to then get strong enough to rebuild itself, regenerate itself, and become as strong as possible so that it weathers the storm on that last end of the lifespan. The word Pañchakarma itself can be written as one or two words. Pancha means the number 5, and karma in this context of Ayurvedic medicine refers to a therapy or a procedure. It is a therapeutic intervention, a known protocol that is performed to produce a specific result. It has certain indications and contraindications, certain timing, certain stages, and it's a whole big process. And so when we talk about Pañchakarma, we collectively are referring to these 5 therapeutic interventions, and their goal, their purpose, is to remove the excess dosha from the body, from its nearest route of exit. That is the classical definition for this group or this block of treatments. So each one of these 5 goes after a certain dosha. And the doshas, for anybody who may not know, are the 3 things that keep us running. They're very, very hard to explain. They're like the things that give us exuberance and life. And yet they're also the things that when they start heading in the wrong direction can take us down and become the breeding grounds for disease. So doshas are almost like having an angel on one shoulder and having the devil on the other shoulder. And it's the same thing. And it just depends on what we feed it for it to go into a certain direction. Does that make sense? So over time, inevitably, right, it's going to happen. Like you go through all this effort and you put all the work in, and 95% of the time, man, you're doing a great job. All your food is clean. You're going to bed at the right time. You're doing your exercise. You feel great, but there's always going to be some small percent where the doshas are given what they need to go into a dysfunctional state. And it may not always even be something that you did on purpose, right? It's like ice cream, chocolate chip cookies, brownies. Those are not always a bad thing necessarily if they're done at the right time and in moderation. Sometimes the doshas get provoked by what's happening outside, the weather, the seasons. That's totally out of our control. But we want to be aware of that so we can calculate where are my doshas right now. And if I know what's happening outside and I know what I'm putting in my body, I can do a pretty rough, quick calculation to understand if things are in homeostasis or not. So over time, inevitably, these doshas build. It's like if you were to not dust your dresser for 30 years, what would happen? There'd be a nice layer, right? On top of that dresser, there'd be some dust and some dirt. And so just like that, dust accumulates in the body. What is this dust? Where does it come from? Most of it is metabolic waste products. And these metabolic waste products find their ways circulating around the body into some spot where they settle. And over time, they have a tendency to all sort of congregate in the same place. They like to hang out together. It's like a pack of wild teenagers that all like to hang out behind the dumpster and cause trouble, right? They're all going to get together somewhere at the same place. So over time, all this stuff builds up, and Pañchakarma was the solution back in the day to cleaning this stuff out, to being able to go in and say, oh, there's a pile of dust hiding behind your left heel. There it is, I can see it. And so we have the person do all these sorts of things so that we can actually almost send this stuff into their body that acts like a magnet. It's like a dust magnet, and it attracts all that hidden dirt in their body. It pulls it out of the hiding spot, brings it back into circulation safely, and then we're able to direct that into the gastrointestinal tract. And depending on where it wants to go, meaning for some people, their waste materials are naturally going to congregate in the upper part of the digestive tract. For other people, their waste materials are naturally going to congregate in the lower or the middle part of the digestive tract. And so if you've ever done any sort of plumbing or anything like that, you know you want to get the thing out wherever it's closest to. You don't want to take something from the top and drag it all the way down through all these kinks and the intestines and all that. And so if that's the case, that type of Pañchakarma is called Vamana, and that's where we induce therapeutic emesis. So we actually give the person, it's like a solid gallon of milk around 5:30 in the morning, right? They're half asleep. And this is after several days of preparation. This is after a lot of other stuff that I'm just going to skip for the purpose of this discussion right now. We give them this gallon of milk, and then we give them what is most likely the nastiest medicine that we have in Ayurveda. It is really, really, really gross. And they have to drink a good liter of that after a gallon of milk. Of course they're going to throw up. So that part is easy. We get the dosha to come up and out, and we have this huge release, right? This huge sort of flushing of the stomach, the esophagus, and even the lower portion of the stomach gets cleaned out with this. So this is the very first of the 5 Pañchakarma. This one cannot be done at home. And so, Carl, again, to your same question, if a person needs to do this therapeutic emesis, they have to go into a facility, and they have to do it under direct supervision of at least one Ayurvedic doctor who's going to have backup facilities in place. There are plenty of complications that can come out of this, which are still in the low category, hopefully less than like 2% of the time, there's actually going to be a complication. But that is enough to warrant having backup facilities in place for every procedure that happens. And this is how it works in Ayurvedic hospitals. In India, they will have nurses on hand, they will have drips ready, they will have other Western medicines ready to go in case the person has a bad reaction to the medicine, or in case they start vomiting and they cannot stop, or along with the vomiting comes some downward movement like diarrhea in addition to that. So one of the biggest dangers with Pañchakarma is dehydration, loss of fluids very quickly. And worst case scenario, absolute worst case scenario, is that this dehydration becomes very excessive and the person can be dead in half an hour. Worst case scenario. Right. So Pañchakarma is like, now think about this. What have you seen? If you've seen anything about Pañchakarma, you see this beautiful woman. She's laying on a massage table with all these beautiful flowers around her, and this oil is dripping everywhere, right? And it looks so wonderful, doesn't it? Guys, that's not Pañchakarma. Those are spa treatments. They have used the name Pañchakarma because it's much easier than the real name they were supposed to use, which is called Bahir Parimarjana. It's a little more difficult than Pañchakarma. So try to put that stuff aside if that's in your mind about, what you think Pañchakarma is. Pañchakarma is not a comfortable experience when it's done to remove the excess dosha from the nearest route of exit. These are difficult surgical-like procedures. Okay, so then the second one is the one that the book is about. And hopefully you got a chance to just take a quick look at that preview, the Complete Guide to Virechana. And Virechana literally means to throw something out of the body, like almost violently. Like when you get some trash in your house, you get this old trash bag that's sitting around forever, and you're really upset that this was not taken out 3 weeks ago when it didn't smell this bad. And you just want to chuck that thing as hard as you can out the window or out the door. That is Virechana. It is forcefully moving through. So Virechana, instead of coming in the upward direction, like the first one does, Virechana goes in the downward direction. And here what we can end up with are anywhere from, at the very lowest, say 5 bowel movements, which wouldn't even constitute a good, strong outcome. That's the absolute lowest that we would expect, to over 30. 30 water bowel movements in less than 12 hours. That's the highest level. Sometimes people will get up to 33, 35, but that's really pushing it. And then again, the higher we go, the more we're putting that person's life at risk. It's not that the whole thing with Pañchakarma is definitely not a more is better approach. And no Ayurvedic doctor in their right mind in India is going to try to say, hey, let's get you as high as we possibly can. That's not the way it works. We usually always shoot for about 15. 15 is our safe zone. And then we have plus or minus 5 on either side. And that keeps us in a nice middle comfortable spot where the person doesn't get excessively exhausted. If you ever had loose bowel movements or diarrhea because of whatever, food poisoning or anything like that, after 3 or 4 or 5 times, 6 or 7 or 8 times, you feel pretty tired, right? You feel like, whoa, the whole rug just got pulled out from under you. And that's exactly what's happening here by evacuating the gastrointestinal tract in its entirety. The person is losing all of their internal support that holds their body up, and so they get completely wiped, completely exhausted from this. So these two, the vomiting one and the pooping one, these are the core of the Pañchakarma. These are the ones that are most intense. They have the best potential to eliminate forcefully remove built up waste materials that have been hiding around in the body and blocking metabolic pathways, causing occlusion of different kinds of vessels, right? Where do strokes come from? Where does embolism come from? Things are building up in the body, and if we can get rid of them before they become a big problem, we are potentially making a huge positive impact in that person's life. Darlene, go ahead.
What if somebody starts vomiting during Virechana?
So that can happen sometimes, especially depending on which medicine that we're using. With the first one that I talked about, where we are trying to induce emesis or vomiting, there's really only one main medicine that we use for that. It's pretty much the same medicine across the board. We may alter the after medicine. There's like a second medicine that we use, but even that is usually almost always the same. Virechana is very different, meaning that we have about half a dozen or so common medicines that we use to target the doshas in that person's body based on what they specifically need. Sometimes some of these do cause vomiting. And where that comes from is because the person may also just have the right proportion of doshas where there's just enough kapha that it doesn't want to come out. And so while it does technically fall under, if we go very strictly, it does fall under a complication. It's not a very serious complication as long as the person does not end up with uncontrollable vomiting. It stops within half an hour. It's only maybe 2 or 3 or 4 bouts altogether. And then it switches over and the flush goes down. Then it's okay.
Okay.
Very good question. Thank you. So those are our 2 main ones, and I'm not going to talk about the other ones yet until we check in with everybody to see, are there any questions at this point? Anybody have any questions? Carl, go ahead, please.
I'm just wondering, would 2 weeks be a good amount of time for this process, or could it be sort of like a 1 week? Maybe if it's your first time and you're in your 50s, it might be more of a 2-week layover of start to finish and full bounce back.
Excellent question. So yeah, let's break that down a little bit because there's a couple of things to keep in mind here. So the preparatory stage that I didn't talk about with either of these is the stage where we send the dirt magnet into the body and we go looking for the dirt and we try to pull the dirt out of its hiding spaces. I'm trying to make this sound as nice as I possibly can, but it's pretty miserable. It involves drinking increasing quantities of usually ghee or medicated ghee. In some cases, it may be oil or medicated oil for a minimum of 3 days to a maximum of 7 days. And for a normal, middle-aged, say generally healthy Caucasian male who's about 5'10", say somewhere between 180 and 200 pounds, that last top-out dose, you're looking at somewhere between 200 to 300 milliliters of ghee. That's an entire Pyrex cup full of ghee on your last day. It's a lot of ghee. Suffice it to say, that's why you might have, if you check my Instagram page, you'll see I found a picture of this ghee and I made it my advertisement image because it's not the woman with the oil on her head. And it's much more representative of the discomfort of this whole process. So what we see is that we've got these 3 to 7 days. We don't know. We can take our best guess If it's a person's first time, sure, maybe, okay, let's be safe and say you're going to need 5 days of ghee. We may start the process and find that, oh, actually, no, your gastrointestinal tract is like this, and it's going to go lickety split straight through, and we have a certain dosing schedule for that, or then maybe the opposite, we may need the 7 days. After that ghee period, then there's a standard 3-day window where we have to let kapha come down. We have to do external abhyanga, so oil massage followed by a steam bath for 3 days in a row. And then the 4th day, we do that oil massage and steam again early in the morning on 7 a.m. Everything's done by 9, dose the medicine around 9:30, and then the person has a very busy day in the bathroom. Beyond that, it could be anywhere from 3 to 7 days for the recovery diet. And that, again, depends on how many times the person went to the bathroom, basically how many bouts they had. So it's really hard to get a solid, specific number on this. The other part of it, too, is that before we even start the ghee consumption, the person's body and their digestive tract has to be exactly ready for this. If we start too soon and their system is not really primed correctly for it, the whole thing is going to go into a complication. So my best advice about this is that if you're really serious and you really want to do Virechana, which I've done this thing, guys, 10 times, and I have to say my whole life is totally different because of this. I have had the greatest health that I can think of for the last 10 years because of this. So I would obviously, recommend everybody try it at least once. You can see for yourself what the difference is, but just make sure that you plan out at least a block of like 3 weeks where you don't have to have any commitments, preferably. And if you can't get that 3 weeks, the best thing to do is wait until you can. Because the last thing you want to do is get 14 days in and you're not done and you have to turn around and get on a plane and go back and you just wiped the whole investment that you put in on that. You know what I mean? It's not worth it. Make sure you have enough time. Don't try to cut corners on that. That's the most important factor in all of this. Does that make sense, Carl?
Yes, I think that's a very good answer. Thank you.
Awesome. Great question. Thank you. Anne, did you have a question? I think you had your hand up next.
Yes, I did. How about if you're in your middle 60s and haven't had it done at all yet? How difficult is it? How risky is it to start at that age?
Great question. So totally doable, but usually what we're going to want is a much longer lead time to prepare the body. Like I just mentioned with Carl's question, when we want to start dosing the ghee, we start that dirt magnet process of going in and trying to get all the stuff out. The body has to be ready to digest or to process increasing quantities of ghee. We start on the first day with like 30 ml. 30 ml, come on, man. Anybody can do 30 ml. That's so easy. It's 1 ounce, it's a shot glass. Throw that thing back around 7 in the morning when the sun's coming up, and you feel great, actually. The first day, the second day usually goes up to about 2 ounces of ghee. That's generally pretty easy too. But here's where it starts to change. If a person is over 60, if they do have long-term chronic debilitating disease of some sort, usually what's going to happen is instead of then going from that 60 ml to say 120 or 150, we're only going to go to 80 or 90. And then we're only going to go to 100 or 120. Like our increments are going to be much smaller. Versus a strong, healthy, younger person who's able to tolerate that big high dose where they end up going like 30, 75, 150, 225, 300, that sort of scale. Okay? So the rest of the thing really applies to this as well. And the idea is that your body needs to get primed beforehand. So sleep has to be locked in. The circadian rhythm has to be really set well. You naturally wake up early in the morning, right before the sunrise. You naturally get tired around sunset or hopefully earlier. And you're able to fall asleep, sleep through the night well. You feel energetic and well rested when you get up. Your appetite is strong. And then we do a couple of days of drying the body out right before we start with the ghee. And that drying effect is so that the body will soak the oil up even more. And we end up with a better outcome on the other end of it. So each and every step, each and every stage of this process is so calculated that this is why it has to be done under constant supervision of an Ayurvedic doctor, so that we know when to go on to the next one, whether we reach the right signs, and how much we need to use of what and when. Does that help?
It does. Yes.
Very good. Thank you. Great question. Okay, Kartikeya, I think you had your hand up next. Would you like to go?
Yes, hi Jessica. See, what if a person is lactose intolerant, and what if a person is vegan? These are big challenges.
Great questions. And the lactose intolerance, interestingly, from the Ayurvedic perspective, is ultimately a dysfunction of the digestive system. And the Sanskrit name that we use to refer to the digestive system and metabolism kind of as a whole, a big umbrella concept, the word that we use is Agni. And this word literally means to burn or to consume. So Agni is that conversion process. And so what's happening is somewhere along the line, somewhere in that metabolic process, there's a malfunction. And so the body is unable to process lactose correctly. Ironically, usually by doing Virechana with ghee, we are able to get to the level of that metabolic dysfunction, break through it, and let the body correct itself. And so unless there's another reason that ghee would be contraindicated for the individual, or rather that a medicated oil would be more appropriately indicated for their type of disease, their presentation, so on and so forth, then I personally would not use ghee as a contraindication for this whole process. Now, the other side of that, your question is, for moral and ethical reasons, if a person is vegan and they don't want to use ghee because of that reason, my preference would be to give them an honest assessment and honest recommendation about what would be the most medicinal line of management for them. And ultimately, they would, get to choose if they wanted to go the ghee route, thinking of it as this is something which is being used for medicine. This is not out of disrespect of anything. And if a person is in the US or in a place where they have access to ghee that is of high quality, and in India, you probably have the best options there. You could go to a local farmer. You could get the milk straight from the cow that you're providing support to that farmer to take care of their cows. And so there's a lot of ways to think about it, and that it is also doing some good in the local economy that way. But if all of that is not going to work for the person, then the only other option is to use oil, vegetable oil, meaning either it's going to be sesame oil or possibly coconut oil, but usually we won't do that. And in fact, when we do use oils, we often only use medicated oils, so possibly even like Mahānārayana or some of the other ones that may not taste so good. They definitely have a stronger, more pungent kind of flavor. Does that make sense?
Yes, of course. Thank you, Jessica.
Very welcome. That's a great question. Thank you. All right. So what else, guys? I would love to... Yeah, go ahead, Kartikeya.
May I? Yeah.
Yes,
which are the best? I believe that there are some specific months or seasons when Pañchakarma is like, it's like the most ideal time to do it. So can you please share information on that?
question. All right. But first of all, I need to put a big asterisk here. And remember, everybody here, like we are covering maybe most of the continents of the world right now, which is pretty cool. India is one of only 2 places in the entire world that has a true monsoon climate. And so because of that, all of the literature in classical Ayurveda, which is all of the Ayurvedic medical literature that has been around for thousands of years, is all in the context of this very rare occurrence of a true monsoon in India. So suddenly now, if we try to take all of this instruction and information out and say, okay, let's go to Switzerland and let's do some Pañchakarma there. Guess what? The whole thing potentially changes, and I have yet to see anybody do any formal research or study on this in terms of like, how are we supposed to realign Pañchakarma to the seasons outside of India? Because this makes a huge difference. So with the first one that I talked about, where we're inducing emesis for the person, right? They're actually throwing up. That one is eliminating kapha dosha from the body. Kapha dosha usually resides in the upper part of the body, and it's responsible for everything to do with strength of the individual. That one is best if we line it up to the season where kapha naturally goes through its peak. So this is a whole other concept that I'm going to try to bring in quickly here. Has anybody ever been to the beach before? Anybody been to the beach, right? When you go to the beach, what's there in the water? What do you see? Usually the waves, right? And so just like the waves in the ocean build up and swell, they reach their peak and then they crash and they come back down. The doshas do the same exact thing every year like clockwork until climate change happens. And then it's all up in the air. But up until this point, it's been pretty reliable and pretty steady. And so coming out of winter time, and this is the same across all geographical locations in the world, kapha builds up in strength over the winter time. And then in the summertime, when the heat of the sun starts to come down and melts the snow on the peaks of the mountains and it starts to melt and run down, kapha in the human body drains out in the very same way in the springtime. So we have these beautiful analogies to help us understand what we're seeing in the external world and reflecting it in our internal self. So when this event happens and kapha naturally melts in the human body, that's our opportunity. We got it, we can really grab it easily and we can drag it right out because it wants to go. Right? Imagine if we got behind the wave and we tried to push the wave forward. It would be so easy because the wave wants to go that way. If we try to stand in front of it and say, no, wave, you can't go, nothing's gonna happen except we're gonna get pushed over. So kapha with the emesis or the vomiting is going to take place preferably in the springtime when kapha is at its maximum and it's ready to flow out. Pitta, okay, which is responsible for all processes of transformation in the body, is best removed at the end of the hot season. Now, this is a little confusing because this happens at totally different times depending on where you are. In India, the actual worst, hottest season is after the monsoon. It is like hell on earth that you would wish to not your worst enemy. I swear to you, it is terrible. Post-monsoon season is so miserable because it was just nice and cool and it was rainy and you're having a great time in the rain. And then all of a sudden the sun comes back out with a vengeance, and it cooks everything. And all the water that's in the earth now starts to evaporate. And so now you're in a steam sauna as well. All right. Yeah, October is the season for Virechana in India. But that's not the case outside of India. Right? October, think about October, where many of you are up in the Pacific Northwest, or anywhere in that middle latitude or northern belt in the US or even in Europe. October can be a beautiful month. Yeah, it's the fall and the leaves are changing and all the colors, and it's a little cold, right? Everything is like dying, actually. October is the time to go for Vata, and that's with therapeutic or medicated enemas, which we didn't talk about today. We'll probably do a different class on that. So in temperate zones, from roughly, let's say, 22.5 degrees north latitude northward, up to like 60 degrees north latitude, that whole temperate zone belt, we're looking at Pitta going through its wave cycle during the summertime and then crashing down at the end of the summer. And so the end of the summer in temperate zones is generally where we want to try to catch that Pitta and hit the flush button and try to get it moved out. And so that's why I'm trying to actually make this ready this year. Finally, this book, guys, just so you know, I started writing this book in, I think, 2016 or 17. So it's been waiting for a long time. But it's finally ready now, and hopefully we'll be able to have a couple people go through this year and get the benefits. You're getting lined up, clearing all that Pitta out at the end of the summer, coming down into the fall, coming into the winter. And winter, guess what? Winter is battery recharge season. That is the time where you're going to build your strength to last for the rest of the year in the winter time. So next winter, when you gain 5 or 10 or 15 pounds, don't be sad, be happy, say thank you, because that's your batteries getting recharged. That's building up your mass so that you have enough to get through the difficult part of the rest of the year, which is the heat and the draining effect that the heat brings. Does that make sense?
Yes. May I ask another
Please,
question?
go ahead.
You know, suppose if I know that I need to do Pañchakarma in October or autumn or X season, what is, can you share your wisdom on at home, what's the best way to prepare so that I gain additional benefit from Pañchakarma?
Meaning preparation like in the months before?
Yes, like, so that I gain a lot more than usual, like, change in lifestyle or certain, like for example, many years ago, I went for a advanced breathing class, and I was the only guy who used to do the neti pot before class, and the kind of experience that I had was a lot more than most students, because my nostrils were completely clear. And then like, how do I or we prepare to get so that the body gains a lot more from Pañchakarma as compared to going there and just starting the preparation for 3 weeks or 2 weeks or whatever it is?
Perfect. So in 2 to 3 months leading up to that, you want to really try to use the correct Ayurvedic medicines that are going to strengthen Agni in a certain way. There are many different ways to strengthen Agni, meaning the digestion and the metabolism. And what we have to do in like 3 to 5 days right before we start the ghee is we have to use very certain medicines that are very hot and very stimulating and very drying. So you don't want to use those for like the 3 months prior, because then they're not going to provide the correct effect in the few days before that. So first of all, you need to find an Ayurvedic doctor who's going to be able to stage this properly for you and do it correctly. Prior to that, there are other types of Ayurvedic medicines that can give sort of an overall effect. The other thing I usually like to have folks do is actually do as much exercise as they possibly can in the 1 to 2 months preceding starting. And this is for several reasons. One, to check what their physical limits are. What is their endurance? What is their stamina? What are their limitations? And so we have a nice checkpoint before we start, so that 3 months after we're done, 6 months after we're done, we have a great comparison point. All right, so all the things that I said earlier, like getting to bed at the proper time, making sure the circadian rhythm is set up correctly, waking up naturally with the sun, that's one of the most important things that anybody can do that is totally free and gets you the most bang for your buck in terms of being healthy for a lifetime. Having meals on a proper schedule, not snacking in between, 0 snacks, no snacks at all right? Drinking the correct fluids. So in monsoon in India, that would be like only boiled water, maybe some jirapani, like water boiled with cumin in it, or some ginger tea, or some sorts of spices, gentle amounts like that, and getting the body as strong as possible prior to starting. That's generally the best way to go about this. So
Thank you, Jessica.
Oh yeah, go ahead. You're welcome. Yeah, so maybe contrary to popular opinion, or even to, this might not have even been a question that would have come up in one's mind, but do we want to do Pañchakarma when a person is in some sort of acute disease? Actually, no, it's contraindicated. We cannot do Pañchakarma when a person has an active fever, when they have an active state of indigestion. Any sort of acute presentation contraindicates the start of this, and we have to cycle all of that through, and we have to get the person to a good base healthy starting point, because the Pañchakarma itself is going to be so exhausting and wearing on them that their body has to be ready to undergo that. Okay, awesome. What else? Who has any other thoughts or questions? Joy, is there a condition such as hypothyroid? How are medications managed? That's a great question, Joy. Thank you very much for asking that. So with Western pharmaceuticals, if a patient has to be on certain medications, then usually what we're going to do is we're going to investigate that whole history first, right? And this again is why we might need 3 to 6 to possibly 12 months of preparation before actually going for Pañchakarma with anyone. Because we want to really check with some of those prescriptions. Number one, how long has the person been on that? Number two, how much do they really need to be on that? And obviously I'm aware of the fact that in the US, you have to have, really in any country, only a medical doctor can change a person's prescription, but we can ask those questions. And so if there's any possibility of perhaps getting that person off those prescriptions, if that is anywhere and outside possibility, antidepressants fall under this category as well. All prescriptions, statins, all right, high blood pressure medications, all the common ones that are out there. We need to go through and look at everything and really say, okay, are we at the lowest possible dose that this person really needs to get the job done? Or are they over-medicating? And if they are over-medicating, that actually needs to be dealt with first. And we need to try to get them, ideally, before starting Pañchakarma, ideally we're going to be off as many, if not all, pharmaceuticals except the most mandatory ones. And so say for somebody who's had like a thyroid ablation or removal of their thyroid, and so they do not produce T3 and T4 like the normal thyroid hormones, yes, for them, they may need to take their medications while they go through this because they have no other way of managing it, or their body is so, that's a different sort of situation. So we got to take it case by case and really try to see what we need and what we may not need. So ultimately the goal is that if you want to be independently healthy, you want to be able to stand on your own 2 feet and say, here I am, this is it, I don't need anything else, and I'm healthy the way I am, right? Ayurveda and Pañchakarma is such a fabulous way to help you get there if you're ready to try to go down that route. And, for those who have been had no other choice but to be on pharmaceuticals, especially for extended periods of time, they're not given any other options by their doctors. It's a hard path to try to change at that point. I totally get that and appreciate that. And so we try to be as reasonable about this, but like keeping it in as safe a zone as possible as well. All right. And Joy, you said, are there good lists available of facilities that provide these services? Hey, that's a great question, Joy. I had started putting a list together, and I think what I'll do is let me send that out to the email list in a couple days and share that with everybody so that you can see, what the options are. It really is going to... Oh, was there a question? Cheryl, did you have a question?
No.
Okay. If you're going to be so adventurous as to go to India to do this, that opens up a whole huge amount of opportunity because there are plenty of centers. And look, I'll be realistic here. If it's your first time going to India and you're over 60 and you're going to do Pañchakarma on your first trip to India, bring a friend. Bring at least one other person with you. Do not go by yourself, all right? India is very much a place of many, many, many people, and nobody does anything on their own there. And this is expected. If you're in a hospital, God forbid something happens, they'll look at you and be like, okay, have your attendant go get the medicine. Everything just works a little bit differently. And so you want to be able to have somebody else, at least one other person with you just in case. Going to some of these nice fancy resorts, the Ayurveda resorts that are probably going to be upwards of $100 US per night. Usually it's all inclusive, like stay, treatments, medicines, food is all included in that price. They'll also be pretty cautious with you, most likely. Meaning that, again, if you're over 60 and your health is a little not so certain, and if you top that off with like some sort of time limitation, I can only be here for 10 days, I can only be here for 14 days, they're not going to take any risk with you whatsoever, and they're just going to do simple external body treatments like oil massage. They might do some heat packs, they might do some small enemas, but they're certainly not going to try to like line you up for a big elimination procedure like Virechana, unless you've contacted them well in advance, you've worked with their doctors well in advance, and you come in prepared and knowing that you are ready. They know you're ready, and that's the direction that you're going to go in. So just see, guys, how much preparation has to go into this, how much planning has to go into this. And this is for your own safety so that there's no unnecessary complications in the process, okay? Carl, go ahead.
I was wondering, does choosing the right time of year for a prospective patient vary by their doṣhic excess? For example, if you have excess pitta, typically then maybe October is better. If you have excess kapha, springtime. Is that what you were saying before about following the wave?
So there's two waves here. One is the external environmental wave, in which kapha is going to peak in the springtime, pitta is going to peak at the end of the summer, and that happens regardless of what the doṣhic load inside the person's body is doing and what the cumulative load is. Now, if we try to measure what that cumulative load of the person is, say they have excess pitta, but now they're in spring season, and they have pitta and kapha going at the same time, the person's going to be very uncomfortable, and they're going to have lots of allergies, and they're going to just feel very irritable the whole time. There's two general ways that we can decide on timing and indication for a strong elimination, like Vamana or Virechana, the vomiting or the purgation, and that is based on the presentation of the person, meaning the assessment of their disease and the state of the doshas at that moment in time. And so we can do any Pañchakarma at any time if the person's presentation warrants it. Does that make sense?
Sure. So it's quite individualized. But if you had excess kapha, would April be more logical than October? Just as a general rule.
Yes, as a general rule, and that would be if you're targeting karma in the springtime with high kapha, it's going for emesis. There's no other way. Like, that's the result that you're going to get.
Right. So also choosing the modality and the season and the
Precisely.
Okay, great, thank you.
Yeah, you're welcome. Awesome, everyone. Okay, great. So we are gonna wrap it up now, and I hope this was helpful for everybody. Did you guys get to learn something?
Yes.
Yeah, maybe. Great.
A lot.
Wonderful. Excellent. That's what we like. Thanks, Cheryl. Cool. Okay, so then maybe we'll do this again sometime and see what kinds of questions come up. Thanks, everybody, for joining. It's a pleasure to get to see all of you and meet all of you, and I hope to see you again soon, all right? Take care.
Bye.
Bye.
Thank you.